Okay, committee, bring the meeting to order. Apologize for taking so much time on this. We're going to, the first thing we're going to do is finish up recommendations from yesterday. We had a few errors in DCF. Okay. So Representative Kincannon.
Thank you, Mr. Chairman. This is what I get for doing things on the fly. But, so I need to correct my motion from yesterday. How would you like me to do that? Should I withdraw it or just amend the amount?
I think we can deal with it however you want to.
Okay, so I'll just read the new motion. I move that the committee adds $250,000, including $50,000 SGF, to establish a pilot program to support youth in out-of-home placements in the custody of the Secretary of the Department for Children and Families in obtaining a driver's license and funding for automobile insurance for FY 2022.
I have a motion. Do I have a second? Representative Rees seconds it. Discussion.
So this is basically the same program that I visited about yesterday. I had the total wrong. I mean, the 50,000 is correct, what would come out of SGF. I just didn't figure in the all funds. And I think I said that yesterday that the total for the program would be $300,000, but it will be $250,000 available.
Very good. Any further?
Yeah, I had also an answer to Representative Lynn's question from yesterday. So the intent is to cover them until they're 18, and they would not have to reapply every year. Once they've been accepted, they would be in the program until they turn 18.
Okay, very good. Do I have
a second? So.
Okay, we have a second. All in favor say aye. Aye. Opposed, same sign. Motion carries. Okay, I have one more addition from yesterday for DCF. I move that the committee add $300,000 SGF to establish a one-year pilot program for the Hope Ranch for Women. The Hope Ranch for Women is required to submit a status report detailing activities conducted during the pilot program, including the number of women served, demographics, client service needs at intake, lengths of services, reason for case closings, recidivist rate, client costs, and average project costs. Additionally, the Hope Ranch for Women will be required to submit a budget itemized report and a budget transaction report to the Social Services Budget Committee by January 31st, 2022. Do I have a second? Yes. Representative Ballard seconds this. Committee, we've had some discussion on this. We've gotten more and more information as we I think you have it now in an electronic form. You'll look at your computer as we've finally added this all up, but it basically is here, and I can certainly pass it around if you want to look at that copy while we're talking about it. But where I'm coming from on this, just basically, there were 177 trafficking folks identified in 2019, 9 businesses identified, 45 traffickers were identified, 92 cases were identified. In 2015, there was only 42. And then if you go to the website about human trafficking, Wichita is at top 5 in the country. And so this is to possibly at least identify and at least help with that situation. So Representative Ballard.
Thank you, Mr. Chairman. I'll comment on that as well. I think we all know that trafficking is really a big problem here. But I think since this is a new program for us and we didn't know much about it, being a pilot program would give us that opportunity to really see how this program works, give us a report, tell us about the population that you're serving, you know, and all the particulars about it, and then we can see how it's working and continue with the funding. And usually we kind of do this way because we don't want to be committed totally to it, but we also know that trafficking is a huge problem.
And I might add, we've kind of been in a hurry, and I didn't get this out, but I do have letters of support from Sheriff Easter, the Mayor Brandon Whipple, and also Attorney General Derek Schmidt for this program. So further discussion. Representative Ruiz.
Thank you, Mr. Chair. When I looked at the question and answer document that was sent by them, I really appreciate that being sent by them, because there were a lot of questions. You know, I'm all in favor for this. I'm uncomfortable with the 8 dimensions of life it's part of their core model, but it's the primary one, not primary. It's the first one that is listed that's called marriage, family and marriage. And I'm not quite sure what that all means other than what is there. I mean, I guess if they were here, I would ask them a little bit more in-depth questions about what exactly family and marriage means. I've never seen this as part of any kind of a model for anything like this, this type of a service. So I'm a little uncomfortable with it, but I will vote in favor for it.
I'm not aware of what that is either, but so committee, further questions? No more discussion? Representative Helmer.
I'm still not sold. My investigation didn't lead anywhere to where I'm convinced that this is a bona fide good therapy program and that they've turned out anything or that they have the horses or the supplies or the transportation or anything that they can withstand or feed or do what was presented to us. So I just want to state that. And anybody can, I've just seen too many of these programs, and anybody can go to Atwood's and tell them, I'm going to do therapy with women. Can I get a letter? I'm going to, you know, and go to the feed stores and go to doctors and get letters and do all of that. I've seen it for years and years and years. So I'm going to stand by what I said. I've talked to too many people already, and it may be a good program, but $300,000 on a pilot program when they don't own their own land, when they don't have their own facilities, when they don't have their own horses, when they're transporting women back and forth from one end to the other, and they haven't turned out any finished product, is a lot of money. So I stand by what I initially said and investigated. Thank you, Mr. Chairman.
Very good. I can appreciate that. I think, you know, I did see that they have graduated women in the second, in the round that maybe I just sent out to you as you got to committee. So you may take a look at that. But I did see licensed therapists on the list. Did you see the list that I sent out day before yesterday? A list of licensed therapists that work there. So we'll monitor it. It's not an ongoing it's not a guarantee. We will take a hard look at it next January. And if these guys are not above board and trying to scam us and not doing their job, then we'll deal with it then. I think sometimes we do have to take chances. And I think human trafficking is probably one of those things that I'm interested in taking a chance on. So that's all I'll say. So it's certainly up to the committee. Further discussion? All in favor, say aye. 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 Opposed? You want your vote recorded? Okay. All right. Representative Helmer would like her vote recorded. Okay, moving on. Do I have any further committee recs?
Yes.
Representative Ballard.
Thank you, Mr. Chairman. I'm going to start with brain injury, because I'm sure lots of us have received our emails about that. We recommend that the agency review the policies regarding the Medicaid home and community-based services brain waiver and implement the following policies. Ensure that HCBS via waiver serves as a rehabilitation waiver. Prioritize Kansans with recent brain injuries and implement a 2-year review on the services with limited exceptions for continuing waiver services beyond 2 years. Some have to go beyond, some can be 2, depending on how early we start, but we know some can go as far as 4 years. Add language that the agency report the following information to the Bob Bethel Joint Committee on Home and Community-Based Services on a quarterly basis. Number 1, number of enrolled members in HCBS waiver at the end of the month prior to the committee meeting, number of enrolled members in HCBS waiver program over the course of the calendar year, an unduplicated count. Number 3, number of brain injury waiver enrollees receiving HCBS waiver services longer than 2 years and longer than 4 years. Number of the waiver enrollees who did not receive HCBS waiver services within 60 days after being enrolled, 90 days after being enrolled, 120 or more days after being enrolled. The number of waiver enrollees who did not receive a specific HCBS waiver service for the following periods: 30 days prior to the date they were enrolled, the 60 days, 90 days, and 120. The amount of the per member per month enhanced dollar rate provided to an MCO for each member enrolled in HCBS waiver, and the total number enrolled in HCBS waiver by county, and the per capita enrollment by county, and progress towards new policy implementation. Part of this is looking at what the growth, how did it grow, where is it growing mostly, how do we contain it, how long are people actually staying on it, and the longer they stay on it, that creates a bigger need for a waiting list. But you don't want to rush them off, because you want to make sure that they're rehabilitated, then they're off of the waiver, which is the unique part about this one. They don't stay on forever. But the key is how early do we get them on? I think you saw from the tape, the woman was talking of the example of the 2 children with similar similarities. One had better progress than the other, and a lot of that depended on how soon they were on it or how late they got on it. And what I'm recommending is that we review these policies so that we know how many, what the age is, how long they're on, and when they come off, and then how productive are they at that point. So the committee notes its concern that the number of individuals receiving long-term services on the Medicaid home and community-based services may hinder its goal of rehabilitating individuals with recent brain injuries. Because we did vote for acquired that may have created it, but we don't want to put all the blame on the fact that the acquireds came on and they're the ones that are inflating it. It just means that some of the injuries may take much longer than we anticipated. Any questions?
I have a second. Second by Representative Reeves. Discussion? I think Representative Ballard pretty much handled that. But I do think, committee, we heard this, talking about the wait list, and we've all been getting these emails, and I do think, it was an $8 million price tag, to try to address this. They're right up against that wait list. And I think we need to analyze why we're up against that wait list. Quite frankly, I think all of you know that wait lists are no good in brain injury. The only way that they work is when you catch them quick at the very beginning. So quite frankly, if you're going to have a wait list on a brain injury waiver, then they probably should go to an ID or long-term care, and I'm not being callous or anything else, I'm just saying that's the whole process of having a brain injury waiver is catching them early. And we heard a lot of testimony in that regard. So with that, further discussion? All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Further recommendations?
Yes. I might as well just do mine all at one time, and I can sit here and listen to everyone else.
Actually, may I
Very
interrupt
good.
real quick?
Yes.
Mr. Chair, so just to be clear, you've closed out the DCF budget and now this is the KDAD's budget, is that correct?
Yes.
Yes.
Okay.
Sorry. That, actually, the last one was, there was 2 for DCF, and now we're on KDAD's.
Okay, thank you.
Okay.
Thank you. This is the, let me see which way we want to do this. The IDD waiver. Motion to establish a special committee on the IDD waiver. Recommend the establishment of a special interim committee, the same as we did one in our ultra budget to look at dental care. This is something else, but obviously differently, to study the state of the home and community-based services, intellectual and developmental disability waiver. The focus of the committee would be to examine issues related to the waiver list, adequate provider networks, and reimbursement rates. With respect to the makeup of the committee, it would be comprised of like House Appropriations Committee Chair, the Senate Ways and Means, House Social Services Committee Chair, Senate Ways and Means Subcommittee on Human Services, House Health and Human Services, Senate Public Health and Welfare, House Appropriations member appointed by the House Minority Leader, and Senate Ways and Means appointed by the Senate Minority Leader. The thought would be that the committee would meet for 4 scheduled meeting hearing dates and should report to the Bob Bethel Joint Committee on Home and Community-Based Services and CanCare Oversight, the House Social Services Committee, and the Senate Ways and Means. It is time, really time, that we look at this waiver list and look at it in terms of how we can either trim it, what do we need to do about it, and what are some of our maybe unique problems that we have that we really could do something about that we just haven't had the time to do.
Very good. Do I have a second? Representative Cannon, second. Further discussion? Well, I'll jump in here. I'm going to wear, okay, he's checking them off as we go. Okay, I'm making sure Matt gets all the, since I got here in 2013, we've talked about the wait list, and it's gotten higher and higher and higher, and we've talked a lot about it. We've talked about the Louisiana model and CanCare oversight, about different waivers to, you know, I think backing up committee, I think you know this, there's 6 services that you accept on a waiver. And so we have to wait till that we can pay for, and they need all 6. Well, some folks only need 2. 65% of them are all on Medicaid already. But it's just, I'm tired of looking at this wait list all the time, and it's overwhelming. So this committee will dive into it and see who's on the wait list. You know, we've heard it's a 9-year wait for the wait list. So we don't know if there's folks on there that have been there for, and don't even need those services, but because it's 9 years for their child or whatever, and they're getting elderly, and who's going to take care of them, so they get on it. And so we just don't know how many people are on that wait list that are actually ready for services. So that's where that comes from. So anyway.
Mr. Chair, I would just add, and also, it's sort of like they have like 6 components, you have to take all 6. And if you don't really need those at the time, then they drop you off, you know, to another part of the list. Maybe we should look at it in terms of what that number is there. But maybe you only need that right now, and maybe someone else could be using those other ones instead of you can't get on it because you can't qualify for all of them. Well, not all of us need everything at that time. Maybe we should be able to figure out what we need so we can help those people, and then if they don't need it, let someone else use it, but you don't get kicked off the list.
Very good. Further discussion? Representative Concanon.
Yeah, I'll just jump in here. I'm in support of this. I think not just look at how to address that, and I think you guys have already said this, but in a different way, but I think that there's some policy and procedure that we actually had some discussion about at the Bob Bethel Oversight Committee, where when some people come off of the brain injury, and then instead of just transferring over, then if they're eligible, transferring over to the other services, they have to go to the bottom of the list. So they've had services, and then all of a sudden, they're at the bottom of the list again.
Almost go back again.
Yeah, yeah, so I'd like to see that committee, I'd like to see this go through and have some discussion about the policy and procedure, too.
Very good.
Thank you, Mr. Chair.
Further discussion? All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Further committee
The last one I have,
recommendations.
remember we mentioned, we passed what, for those of you who were here, we passed the 750,000 out of SGF for the crisis center that we were establishing in Lawrence. And we have 4 others, and this is the 5th crisis center that we have in the state. And we passed it in appropriations before we adjourned in March, but it was cut from the allotment. What we found out for 2021, they were able to find those funds for the 750 for 2021, but that was out of the lottery funds. So what we need to establish, which is what we were going to establish last year, was the 750 from SGF for the Douglas County Community Crisis Center, and appropriate the Douglas County Crisis Center base account as a separate state general fund account for FY 2022, so that they have a steady funding.
I have a motion. You second? Oh, seconded by Representative Helmer. Discussion. Seeing none, all in favor say aye. Aye. Opposed, same sign. Motion carries. Further recommendations? Representative Kincannon.
Thank you, Mr. Chair. I recommend that we add 4.2 million, including 1.7 million from SGF, to provide a $10 increase for the daily reimbursement rate for nursing facilities for 30 days, following the end of the COVID-19 public health emergency in FY 2021.
Motion. Do I have a second? Representative Vaughn. Discussion. Pretty simple.
It's pretty self-explanatory.
Yeah, you know, committee, the nursing homes have been hit badly with this COVID, and we're going to try to attempt to shore them up to get through this, and hopefully we can. So that will be the first recommendation of several. So anyway, further discussion? All in favor say aye. Aye. Opposed, same sign. Motion carries. Further committee recommendations. Representative Kincannon.
Barbara gets to keep going, then. Representative Ballard, sorry. Okay, so I recommend we add 49.8 million, including 19.9 million from SGF, to provide a $20 increase for the daily reimbursement rate for nursing facilities for 178 days in FY 2021. This recommendation is to continue the daily rate increase provided due to the COVID-19 pandemic for the remainder of calendar year 2020.
Do you have a second? Representative Helmer, discussion? A little background on that. We paid the nursing homes $20 a day during COVID for 120 days. This would take it from that 120-day payment until the end of the year. Again, same argument, different subject, but the bottom line is our nursing homes, a lot of the break-even capacity on a nursing home is about 80%. Our nursing homes right now are averaging 69% capacity. So they're literally hemorrhaging money. And if we don't do something, we're going to have to find a place to put those folks. It's just about that simple. So further discussion. All in favor, say aye. Aye. Opposed, same sign. Motion carries. One more?
Okay, I recommend we, oh, sorry, did you recognize me?
I did.
Okay, thank you. I recommend we add 20.5 million, including 8.2 million from SGF, to provide a 3% increase in the Medicaid reimbursement rate for nursing facilities for FY 2022.
Motion? Second by Representative Ballard. Discussion? The nursing home rebasing is required in statute. We have never done it. We very rarely do it, whether you're a Democratic governor or a Republican governor, and we're required to do that. Last year, we ended up in our budget, I ended up with 3%, Senate did. Bottom line was, we got 1% through the budget, and then the governor allotted it. So that's where this comes from. So anyway, further discussion? All in favor, say aye. Aye. Opposed, same sign. Motion carries. Representative Kincannon, you have any more?
Thank you, sir. No.
Okay. I'm going to cut in here because then we can finish up the nursing homes. And the only reason I'm doing this one is because there was a little bit of the writing was not quite like it should have been. It was typed out differently than what I'd written, which, as Francie can attest to, that's sometimes difficult at best. So anyway, I have a recommendation here for the nursing home, nursing facility daily rate increase recommendation. Do I have a second? Second by Representative Ruiz. Okay, add 33.6 million, including 13.4 million from SGF to provide a $20 day increase for the daily reimbursements rates for nursing facilities for 120 days, starting January 1st, 2021. Add language making this funding subject to review at the end of the 120 days by the LBC. The original deal said contingent on the approval of the Legislative Budget Committee. So this is in fact just making at the end of that to be reviewed by the LBC Budget Committee to continue it or stop it right there. This recommendation is to continue the daily rate increase provided due to the COVID-19 pandemic for the remainder of the calendar year. And that would be going to June 30th. The only reason I read that is because it didn't read right. Okay, discussion. Representative Helmer. I don't know, and I don't know if I want to know, quite frankly, but a lot of money, how's that? Okay, committee, further recommendations. Representative Ruiz.
Thank you, Mr. Chair. For the Senior Care Act funding, we'd like to add 3.3 million, all from SGF for Senior Care Act services for FY 2022. The Senior Care Act is a program that offers Kansans 60 years of age or older the opportunity to receive in-home, non-medical supports to prevent premature nursing home placement for persons who have not exhausted their financial resources.
Second by Representative Ballard. Discussion. A lot of us have discussed this. I mean, you know, these things are kind of redundant. And again, the $3 million that we had in the budget last year was allotted. So this is just replacing that funding, and they just missed a year. So anyway, all right, all in favor, say aye. Aye. Opposed, same sign. Motion carries. Representative Ruiz.
This is for the Community Mental Health Center funding. Add 2 million, all from SGF, for additional funding for Community Mental Health Center grants for FY 2022.
I have a second by Representative Ballard. Discussion. This is kind of like a broken record, but it was money that was in the budget last year that was allotted by the governor. We're just replacing it, and they've lost one year of funding. So further discussion? All in favor, say aye. Aye. Opposed, same sign. Motion carries. Further recommendations? Representative Vaughn.
Thank you, Mr. Chair. Representative Ballard talked about the needs within the IDD community, and in addition to setting the wait list, I think it's really important that we increase the reimbursement rates. So I would like to recommend that we add 22.1 million, including 7.9 million from SGF to provide a 5% increase in provider reimbursement rates for the Medicaid home and community-based services for intellectual and developmental disabilities waiver in 2021. And then I would like to make the same recommendation in a moment for fiscal year 2022.
Okay, we'll take one at a time.
Sure.
Okay. Discussions, second by Representative Ballard. Everybody understand that? It was allotted out of our budget for last year. It was 8.9 million. It was a little different figures because we weren't getting the increased FMAP. So it's a little bit different figures, but that was allotted. And this is for 2021. And hopefully it'll make up for what they didn't get for the rest of the year. So further discussion. All in favor, say aye. Aye. Opposed, same sign. Motion carries. Representative Bond.
Thank you, Mr. Chair. Following up on that, I would like to make the same recommendation for fiscal year 2022. Would you like me to repeat the recommendation itself? To add 22.1 million, including 7.9 million from SGF to continue the 5% increase in provider reimbursement rates for the Medicaid home and community-based services for the intellectual and developmental disability waiver in fiscal year 2022.
Second by Representative Ballard. Discussion.
I have a comment on that one. You know, I think it was a real disappointment for the IDD community because they were looking forward to that money and the 5% increase. And yet they understood at the time the governor had to make that decision. We didn't know about jobs. We didn't know who was being laid off, what COVID was doing and everything else. But nevertheless, it really was kind of really devastating in a way. But so this will, I think, make up for it. But more than that, it was a need. And now we're hopefully be able to follow through. Thank you.
Very good. Further discussion? Representative Helmer. No, it's just for 21 and then for 22. Yeah. Very good. Further discussion? All in favor, say aye. Opposed, same sign. Motion carries. Representative Donahoe.
Thank you, Mr. Chairman. This is with regard to the BI waiver inclusion in caseloads. Recommend the House Social Services Committee review the agency's progress to address the committee's concern regarding the number of individuals receiving Medicaid home and community-based services brain injury, HCBS/BI, waiver services and the rehabilitation goal of this HCBS/BI waiver service during the 2022 legislative session. Should the concerns remain unaddressed, the committee would recommend expenditures for the HCBS/BI waiver services be included in the Human Services Consensus Caseload process beginning fall of 2022. Should the HCBS/BI waiver services be included in the consensus caseloads estimates, the estimate would include an expenditure for all HCBS/BI waiver enrollees, which would not allow the waiver to have a waiting list.
Very good. Do you have a second? Second by Representative Helmer. Discussion? think, committee, this goes back to, again, taking a hard look at that brain injury waiver and trying to address as best we can the wait list on that. So further discussion? All in favor, say aye. Opposed, same sign. Motion passes. Representative Donahoe.
Thank you, Mr. Chairman. Recommendations for the Kansas Department for Aging and Disability Services, TA waiver reimbursement rate increase at $21.8 million, including $8.7 million from SGF for the Medicaid Home and Community-Based Services Technology Assisted TA waiver for FY 2022. Add languages directing this funding be used to increase the provider reimbursement rates for the specialized medical care T1000 services code from the current rate of $31.55 per hour to $47 per hour for in-home Medicaid care registered nurse, licensed practical nurse, nursing services for this waiver.
Very good. Do I have a second? Representative Ballard, discussion. Representative Ballard could speak to this as well as I can. We've talked about the TA waiver for years, and there are some very good facts out there about, it's basically about being able to hire a nurse to keep these folks out of a hospital. And there's a gentleman that has done extensive research on this fact and to back up these figures. This is actually a money-saving deal, $4,000 a day in a hospital or $47 an hour. And that's how simple it is. But anyway, this was also in the budget last year. It was not this full amount. I think I had it in there. This committee had it in there at 47, and in the conference committee report, I think they dropped it to either 37 or I think it was 37. So anyway, and then that was allotted by the governor. So any further discussion? Okay, very good. Seeing none, all in favor say aye. Aye. Opposed, same sign. Motion carries. Further committee recommendations. Representative Helmer.
Recommendations for the Kansas Department for Aging and Disability Services, KDADS to grow pace. Add language, I recommend add language directing the agency to seek requests for proposals, RFPs, from potential providers to help grow the provider network for the PACE program.
Very good. Do I have a second? Representative Ballard, discussion? You know, we heard a lot about the PACE program, and this is just part of trying to you know, get it going, get it off the ground, and save some money, and also serve folks better. So anyway, discussion? None? All in favor say aye.
Aye.
Opposed, same sign. Motion carries. Further recommendations? Representative Helmer.
The same recommendation from the Kansas Department for Aging and Disability Service, PACE into caseloads. Recommend the directing PACE program expenditures be included in the Human Services consensus caseloads process beginning spring 2021.
Very good. Second by Representative Ballard. Discussion? Committee, we heard testimony that it used to be in the caseloads and then was taken out. So we're just asking to put it back in. Mm-hmm. Very good. Further discussion? All in favor say aye.
Aye.
Opposed, same sign, motion carries. Further recommendations? Representative Helmer.
The same Kansas Department for Aging and Disability Services PACE protected income level. Recommend add X.X million, including X.X from SGF, and add language raising the protected income level for the PACE program from 150% to 300% for fiscal year 2022. The Budget Committee's intent is for with annual adjustments going forward.
Very good. We did finally get some numbers on that, and that is 235,000 all funds and 159,950 SGF. So it's not millions. So it's just a few thousand, I mean, not a few $1,000s, but yeah. But yeah, sorry about that. We didn't have the numbers, and Matt just gave them to me. They're right here. Yeah, here it is. To raise the PACE protected income limit up to 300%. It's SGF 159,134 and 235 all funds, 235,543. Okay, discussion. Representative Ruiz.
Just a point of clarification. What does this do to House Bill 2249? Does it do anything to?
No, it doesn't do anything. And one of the things that I wasn't sure that you could do is if you could raise just a certain population up to 300%. And KDHE has assured us that we are able to raise them up. And I realize there's going to be some criticism because not everybody's going to get it, but we can say that this is a start to raising it to that. But if we don't do that, we're not going to get anybody on PACE to join PACE because, as we talked about on that bill yesterday, the problems that folks have, as you heard Sean Sullivan testify, that folks are enrolling off of it because they just can't afford to lose the money that they would get when they enroll in PACE.
Thank you.
Very good. All in favor, say aye. Opposed, same sign. Motion carries. Further recommendations. Representative Vaughn.
Thank you, Mr. Chair. I have one more. I would like to recommend that we add 1 million all from SGF for a psychiatric residential treatment facility pilot program at Ember Hope in Newton, Kansas for fiscal year 2022. This funding would be used for 12 PRTF beds. And it's my understanding that that's a big need, especially for youth in that part of Kansas.
Very good. Second. Discussion? Representative Ballard.
PRTF, I mean, for those of you who don't know, at one point we had something like 836 beds that were available in the state. Now we're down to like 432. And part of that is for youth. We just don't have psychiatric residential, and that is such a big need. And part of that need is like geographically too, sometimes that you may have it over here, but you don't have it there. And 12 beds may not sound like much, but that's really a lot when you don't have it and where it's going to be located. So that's really one of the reasons why I really second it, because I'm very excited about some new beds. Thank you.
Further discussion. I might add that this was in the budget last year and was allotted. Passed the Senate and the House. So, all right, all in favor say aye.
Aye.
Opposed, same sign. Motion carries. Further recommendations. Representative Lynn. Sorry.
Thank you, Mr. Chair. All right, this is in regards to the CCBHC certification. Add language directing the agency to, this KDADS, to establish a process for certification and funding for certified community behavioral health clinics. Example of the language could be the Kansas Department for Aging and Disability Services shall establish a process for certification of and funding for certified community behavioral health clinics. The Kansas Department for Aging and Disability Services shall certify as a certified community behavioral health clinic any community mental health center licensed by the department that provides the following services: crisis services, screening, assessment and diagnosis, including risk assessment, person-centered treatment planning, outpatient mental health and substance use services, primary care screening and monitoring of key indicators of health risks, targeted case management, psychiatric rehabilitation services, peer support and family supports, medication-assisted treatment, assertive community treatment, and community-based mental health care for military service members and veterans.
Very good. Do I have a second? Representative Ruiz. Discussion. Representative Ballard could speak to this just as well as I can. This is a language fix for the CCBHCs. There's no funding at this point in time, but this is just what they need to get the program started. Might add, as I think, I've been in so many committees, but did the secretary talk about was there 4 more or 5 more that received the grants? Yeah, I think it was 4 or 5 more that received the starting grants for the CCB CH program, or what, I don't know.
Certified, community certified. I had to learn that one, and that's one important.
Certified Community Behavioral Health Center. Okay, and so we're started down that road. So we had a recommendation in KDHE to do the language for KDHE. This is the language for KDAD to do that. So further discussion. All in favor, say aye. Aye. Opposed, same sign. Motion carries. Okay, Matt's telling us that we have not lost any of them since then, since this start here. Okay. Committee, further recommendations? Very good, I'm glad. Okay, we're going to close the recommendations on KDADs, and we're going to open the hearing on House Bill 2248.
Representative
With
Carpenter?
that, yes, sir.
I just wanted to clarify, so to pass out the budget as amended.
Oh, yeah, sorry. I'd make a motion to pass out KDAD's budget as amended. Second by Representative Ballard. All in favor, say aye. Aye. Opposed, same sign. Motion carries. Matt, did that take care of it?
Yes, it did, Representative Carpenter.
Okay, what I wanted to visit with you about, did you get that language change on the, it was a daily rate on the nursing facilities for 120 days?
I have, and I'll make sure that
Okay.
the subcommittee report reflects that.
Yeah, it's right after making this funding contingent. It should say subject to review at the end of the 120 days by the LBC. Okay?
All right.
Very good. Thanks for keeping us straight. All right, committee, I'm going to close the deal on KDAD's recs and open the hearing on 2248. With that, we have Megan to give us an overview of 2248. Megan, are you there?
I am. Thank you, Mr. Chair. I'm Megan Leopold from Legislative Research. I'm going to provide a brief overview of 2248, which is changing the statutory formula that is currently used to fund local health departments. Currently, each local health department in Kansas that applies receives a minimum of $7,000. If additional funds are available after providing each local health department with the minimum amount, then the rest of the money is distributed based on population served by that county, by the county served by the health department. This bill would raise the minimum amount that's distributed to each local health department to $15,000 from $7,000. This would only occur if the state financial assistance for that fiscal year is $3 million or greater. If the state financial assistance is less than $3 million or greater, the minimum distribution would still remain at that $7,000 per local health department. Currently, there is 2.2 million state general fund available in KDHE's base budget for local health departments. So raising the minimum amount from 7,000 to 15,000 is subject to appropriations. That being said, this committee did recommend adding 1 million to the state funding formula, which, if included in the appropriations bill, would activate the raise in this bill to raise the minimum amount from 7,000 to 15,000. I'm happy to stand for any questions.
Very good. Thank you, Megan. Committee questions? We had this bill last year, but because of the shortened session, we didn't get anywhere with it. So this is it. Representative Concanon.
So I wasn't here last year, so can you explain the $3 million again? Where does that come from?
So currently, KDHE has in their base budget $2.2 million to be distributed. The raise of the minimum amount from 7,000 to 15,000 would only go into effect if there was $3 million or more available to be distributed using this statutory formula.
So there's 2.2 million there. Is that money that we appropriated?
Yes, that's in the base budget. That's been in the KDHE base budget already. But the committee recommended an additional $1 million for local health departments.
Okay, thank you. Thanks, Mr. Chair.
And Megan, wasn't there some discussion, isn't that, when was the last time that was raised?
I believe it was 1992.
That's what I was thinking. It's been a long time. 1992 was the last time they received more, or they received the 2.2. So I don't know, what is that, 20 years? Pretty close. Oh, that makes me feel really old. Okay, committee, further discussion. Seeing none. Megan, thank you very much for that. You're just almost done with this committee for the year, so thank you very much for your help. Next, we have Dennis Griezel with the Kansas Association of Local Health Departments. Dennis, are you there?
I am. Can you hear me?
We can.
Excellent. Well, thank you, Chairman Carpenter and members of the committee, for allowing me to testify in favor of House Bill 2248. As Megan noted, it's designed to adjust the minimum payment that local health departments receive under what we in public health call the state formula, which is controlled by 65242. And the minimum amount was also last revised in 1992, is our understanding. So that $7,000 has been in place for 29 years, as has the $2.2 million allocation. The reason why the threshold is set at $3 million to trigger the increase from 7,000 to 15,000 is so that we do not decrease the amount of funding that would go to larger health departments in order to underwrite this minimum payment amount that goes to smaller health departments. And I'm using smaller health departments very loosely because approximately 2/3 of the health departments only get the $7,000 currently. So based off of the latest formula that they're applying for, I believe out of the 105 counties, there are 100 health departments that cover 105 counties, but out of 105 counties, 68 are only allocated that $7,000. So basically that's $8,000 per health department, 100 health departments, $800,000 plus 2.2 million equals 3 million. So that's how we derived that number to be sure that everyone would be held harmless. Other than that, as I was already noted, there's no actual fiscal impact of this bill itself in terms of state finances. It's subject to additional allocations from the state formula. This committee recommended $1 million, which I believe was also agreed to by House Appropriations earlier today. So if that were to go through, then it would trigger the $15,000 minimum if this were to become law. And if we were to get allotted again, like we were last year, then it would go back at the 7,000 so that you weren't paying all of these 68 counties, 15,000, and you're taking it away from the 30 plus counties that would normally have relied on more funding. Other than that, the statute pretty much stays the same. It maintains all the maintenance of effort requirements that the county governments have to receive the funding. And so for those reasons, we would encourage you to recommend it favorably, and I'll stand for questions.
Committee questions? Representative Ballard has a question for you.
Thank you. I'm going to ask you, thank you, Mr. Chairman, ask you to repeat something because I'm not clear about it myself. So right now, you have 68 counties, right, that are receiving 7,000?
That's for what they are currently applying for fiscal year 2022. At least when I loaded up their spreadsheet, and in my testimony, I do have a link to that document so you can access it from KDHE, but I went through and tallied them, and I came up with 68 counties out of the 105 get 7,000. Now, there are a couple multi-county departments, and those counties pay their share into the multi-county. So those two multi-county departments get over 7,000, but some of their members only contribute 7,000.
Okay, but they share. All right. So now, explain this part again with the minimum of 15,000. I'm still not sure about that.
So if we increase the amount that goes into the formula, like this committee recommended a few weeks ago, but we don't increase the minimum, then based off of how the formula, the equation works, a lot of health departments won't actually see any increase. So what we want to do is make sure that when we're adjusting the formula to factor in inflation and population changes, we also want to be sure that those smaller counties are also getting an adjustment that reflects the fact that we've had 29 years of time go by since those numbers were established in 1992. So we set on the $15,000 as an amount that's over the inflation amount. We set on that amount as a value at the $3 million threshold that none of the urbans would lose anything versus what they get at 2.2 million. So everyone would gain funding under that model is the idea.
Okay. That's good. Thank you for clarifying that, because I was trying to figure out where it was coming from, but it's because there's such a big lag in between, and that it's not prorating, but you're making sure that everybody gets something.
Yes. My members would probably eat me alive if I didn't do it.
Well, I wouldn't want that to happen to you. Thank you very much. Thank you, Mr. Chairman.
Committee, further questions? Very good, Dennis. Thank you for being here. And let's hope we can push this thing over the finish line. All right, committee. You see written testimony, obviously, from a bunch of other health departments, which shouldn't be any surprise to anybody. And any further discussion? I'm going to close the hearing on House Bill 2248. Megan, just for clarification, can I take up action on bills previously heard today?
I believe it said in the agenda. Let me look in the agenda and make sure that was
I think it does.
public notice.
Okay.
Yes.
I do. Okay, very good.
Mr. Chairman.
Committee, let's take a look.
Mr. Chairman.
Chair.
Yes.
This is Scott in the revisor's office. I would just remind you of the House rule that requires, if you are intending to take action on the bill you just heard, that does require a 2/3 vote by the committee.
Yeah, I was going to just do the ones that we heard Monday and Tuesday. And tomorrow we can do this one. Will that work, Scott?
Yes, Mr. Chairman, as long as it was in the agenda, that does not require any special action.
Okay, very good. Committee, I'm going to open the hearing on House Bill 2250, the newborn screening bill. We heard Monday. I think I need a second to open that. Second, discussion on House Bill 2250, the newborn screening bill.
Propose that we pass House Bill 2250, newborn screening bill, out favorably.
I have a motion to pass out House Bill 2250, the newborn screening bill, favorably. Yes. All in favor say aye. Opposed, same sign. Motion carries. Okay, I'm going to open up House Bill 2249. Representative Ruiz.
Sorry, I was waiting for it. Is this discussion time?
No, we need to recommend.
Yeah, you'll make the motion.
I have an amendment.
Okay.
All right, well, we've got to do the bill first.
I'll make the motion.
Okay.
Mr. Chairman, I move that House Bill 2249 be favorably passed.
I have a motion. Do I have a second? Representative Vaughn? Oh, Representative Concanon? Okay. Discussion.
Thank you, Mr. Chair. I have an amendment. I know that the agencies would like to see it instead of 150% to the 300%. And we talked about that is just not doable right now. But I have an amendment asking for 200%. So it'd be 50% over the 150 that is already in the bill. So that would be my amendment. It would be striking the 150% and adding 200%.
Do I have a second? Second by Representative Vaughn. Discussion. Do we have any idea what the fiscal note is on that? Oh, thank you.
No, I don't know what the fiscal note would be.
There was 2,450 folks left on there.
2249.
Right, yeah, 2,400 people left.
Left on there. I don't know what 200% would do, you know, as far as that goes. I have no idea what that would be.
There's no fiscal effect on the 150, according
Right,
to,
right. This would just be
yesterday.
adjacent, anything, the 50% that you're talking about.
Right.
Okay. Further discussion? Representative Donahoe.
Yeah, didn't you have the numbers when you recommended 300%?
Yeah, but that was only for 775 people, the
Okay.
people that were on pace.
Okay, it wasn't for the 2,400.
Correct.
Okay, all right, thank you.
Representative Concanon.
Does this impact the neutrality?
I don't remember what, let me see if I can find. Megan, do you remember our conversations from yesterday about budget neutrality? What was it? The protected income limit did not at 150%. Is that correct?
I think it might.
The 150% is already in the budget from the proviso from last year. I don't know if moving it up to 200% or 300% would have a fiscal impact, or I'm sorry, would affect the budget neutrality.
I think he said the other day that there was some wiggle room.
Yeah, I don't.
But by not having the fiscal note, I don't know how close we are to that.
Yeah. Committee, while I certainly sympathize with Representative Rees's, I think at this time I would oppose that amendment. But it's the committee's choice. We could postpone this hearing, I suppose. Scott, are we able to postpone this until we get a fiscal note?
Mr. Chairman, that is certainly your prerogative.
Okay.
But we debate this on Friday.
Right.
Yeah, we do this on Friday.
No, this is totally separate from that. This is a bill. This isn't a bill.
Oh, it's bill, it's not budget.
This is a bill. So, would the maker of the amendment and the pull this until we can find a fiscal note?
Yes, I would agree with that.
Okay.
And is that okay with the second?
She was the second, but it's okay with me as well.
Okay. So I think at that point in time, we'll just close this hearing on House Bill 2249 until we find a fiscal note on the 200%.
We get the fiscal note and the neutrality.
Right,
Those are
okay.
the two things we need.
So Megan, are you clear? We need the fiscal note and the budget neutrality issue on that?
Yes,
Everybody
I
clear with-
will.
Okay, is everybody okay with that? All right, very good. Do I need to do anything else, Scott?
No, Mr. Chairman, you would be available to take the bill up again whenever you so chose.
Okay, but I don't have anything out there right now with this bill that I didn't do.
No, Mr. Chairman.
Okay, well, I'm in pretty unfamiliar territory. We don't do that many bills, so just keep me straight.
We're starting to get them though.
Okay, and I do have, I did misspeak on the recommendation for KDAD's pays protected income level. It was 235,000, include the all funds amount was, what did Matt tell me? $394,677. So I forgot to add the two of them together. So,
Oh, okay.
yeah. Well, it was 235 and 159. So that was the all funds amount. I read them wrong.
So
it's
394.
right. So I guess I would make that recommendation to change that to the correct figures. Do I have a second?
Yes.
Second by Representative Ruiz. All in favor, say aye.
Aye.
Opposed, same sign, motion carries. So now we've corrected that. Is that going to correct it all, Megan? Or Matt?
This was the KDAD's recommendation.
Yeah.
Yeah, I'll verify with Matt the numbers.
Okay. All right. Thank you. Committee further discussion. Good work. We're just almost winding down. I know it's been a heavy lift, and I know that it's going to be a heavy lift to get this through, but I certainly, I don't apologize for anybody for this, and I wouldn't as this committee. There's a lot of people out there that are in a lot of need, and we're doing the best we can. Representative Helmer.
Oh, good. Yes, uh-huh. Yes.
Yeah, that's the health department bill we just finished. Yeah. Yeah. Very good. Further discussion?
One thing that we talked about last year, especially when they start talking about the health department, that they really don't get increases that often, but yet, remember, they still are responsible for Homeland Security. And now that we had COVID, they've had to figure out if they have the vaccines, how to get them, how to help people, how to do all those kinds of things as well. So really, when any kind of disaster hits, the health department is like one of the first to do it, and yet in many ways, they don't get credit for all the work that they really do, or their physicians, or their nurses, or all those things. And the fact that we've neglected them, really, since 1992. So, I mean, it's really created a problem. So they were grateful last year that we gave them a little bit of money. Now it's like really raising them up to what I think their statue really should be in your community, because almost regardless of you're rural or urban, you have a health department. You may not have one right there for you, but you do have access to a health department. And for people who can't afford to really pay, or people who really need to get some attention, the health department is filling in for that. So I just really want to praise them for the work that they're doing, though they don't always get credit for it. And I'm really glad, because I've received a lot of positive, too, for them, because I think people realize how much they rely on them and how much they have relied on them during COVID. And those people go to work every day and they did not have their vaccines or anything else. And at one point didn't have all the PPE that we needed and everything else. And we were hunkering down at home and rarely getting out there to see people. And they were there in order to help. So I'm really pleased that we are really recognizing them for the good work that they're doing in the communities.
Representative Cannon.
I just want to follow up on those great comments. I think that when we did our emergency orders, we put so much back to the counties on those decisions, and the county health departments bore the brunt of a lot of the people that were upset and angry over mask mandates and some of those things. And they were working very hard and trying to make good public health decisions, and took a lot of criticism. But I think that in the end, it showed they were doing the right thing. And also, I think that we all learned a new appreciation for our health departments that maybe we didn't realize how important they were to our communities. So I'm thrilled that we're doing something for them. Thank you, Mr. Chair.
Very good. Further discussion? Okay, seeing none, thank you. We'll have some more committee meetings, but again, thank you guys for all your hard work. It's been a great session. We're winding down. We'll finish up tomorrow evening. We'll finish this bill, and we will have action on 2248, and then we'll have the fiscal notes, and we'll on the protected income limit, and we'll finish those up tomorrow. So very good. With that, we're adjourned.